Gliomas are a category of aggressive brain tumors arising from glial cells, with glioblastoma multiforme being the most malignant form. These tumors are known for their rapid proliferation, high invasion into brain tissue, and resistance to conventional therapies. Treatments such as surgery, radiation, and chemotherapy, for example, temozolomide, often yield limited success, with median survival rates remaining dishearteningly low, typically around 15 months from diagnosis for glioblastoma multiforme. The aggressive nature of glioblastoma multiforme and the challenges of drug delivery to the brain due to the blood-brain barrier drive the urgent need for alternative or supplementary treatments. Simpson Oil is rich in cannabinoids, primarily tetrahydrocannabinol and cannabidiol, which have shown potential in preclinical studies to exert anti-cancer effects on several levels. Tetrahydrocannabinol and cannabidiol can influence cellular processes that may lead to apoptosis, which is programmed cell death, and autophagy, the body's way of cleaning out damaged cells. Let's examine some specific mechanisms that are most promising for high-grade glioma. Cannabinoids, particularly tetrahydrocannabinol, have shown the ability to bind to cannabinoid receptors CB1 and CB2 on glioma cells, leading to a cascade of events that can trigger apoptosis. Binding to these receptors activates the MABK pathway and stimulates the production of reactive oxygen species. Elevated reactive oxygen species within cancer cells can lead to mitochondrial damage, initiating the cell's self-destruct sequence. Angiogenesis, the growth of new blood vessels, is essential for tumors like gliomas, which require substantial blood flow to sustain their rapid growth. Studies suggest that cannabinoids like cannabidiol may reduce vascular endothelial growth factor, a key player in angiogenesis. By disrupting this pathway, cannabis compounds can potentially starve the tumor by limiting its blood supply. Antiproliferative effects via mTOR pathway modulation. The mammalian target of rapamycin, or mTOR pathway, is involved in cellular growth and metabolism, and is often upregulated in aggressive cancers like glioblastoma multiforme, or GBM. THC and CBD have been observed to interact with the mTOR pathway, potentially slowing the proliferation of glioma cells and impeding their ability to spread. Induction of autophagy. Autophagy is a process that enables cells to degrade and recycle components, and it plays, well, a complex role in cancer. In some cases, cannabinoids induce autophagy in cancer cells, leading to cell death. Preclinical evidence suggests that THC may activate autophagy by interacting with CB1 and CB2 receptors, creating a toxic environment within the cancer cell and ultimately leading to its demise. Potential synergistic effects with conventional treatments. There is emerging evidence that cannabinoids can enhance the efficacy of certain chemotherapy agents, such as temozolomide, by sensitizing cancer cells to these drugs. Additionally, cannabinoids have been observed to reduce chemotherapy-induced side effects like nausea and vomiting, improving patients' quality of life. Clinical evidence and case studies. While much of the research on cannabinoids and high-grade glioma has been conducted in preclinical settings, there are a few notable case studies and clinical trials indicating that RSO may offer tangible benefits for glioma patients. For example, in a study at the Complutense University in Spain, researchers found that a combination of THC and CBD with standard chemotherapy significantly prolonged survival in animal models with glioma. Additionally, anecdotal reports from patients using RSO have documented improvements in symptoms and reductions in tumor size, though controlled studies are needed to confirm these observations. One case study of a patient with glioblastoma who used RSO alongside conventional treatment showed promising results, with scans indicating a reduced tumor size over several months. While these cases are not universally reproducible in our politically restrained medical environment, they point to the need for rigorous clinical trials. Patient-centric benefits of Simpson Oil. For late-stage glioma patients, symptom management and quality of life are critical concerns. Beyond its potential anti-cancer effects, RSO can provide relief from a range of symptoms commonly experienced by glioma patients. Pain relief. Cannabinoids are known for their analgesic properties, which may alleviate the intense headaches and neuralgia associated with gliomas. Reduction of nausea and vomiting. Cannabinoids can mitigate nausea and vomiting, especially when triggered by chemotherapy. Appetite stimulation. Glioma patients often struggle with reduced appetite, leading to weight loss and malnutrition. THC in RSO is known to stimulate appetite, improving caloric intake and overall nutrition, mood stabilization, and anxiety relief. Glioma patients face immense psychological challenges, including anxiety and depression. Cannabinoids interact with serotonin receptors, potentially helping to stabilize mood and alleviate anxiety. Safety and dosing considerations. The use of RSO should be approached carefully, particularly with guidance from medical professionals experienced in cannabinoid therapy. The high THC concentration in RSO can lead to psychoactive effects, and dosing may require adjustment based on individual tolerance. Some patients may prefer CBD-rich formulations or lower THC concentrations to mitigate psychoactive effects while still benefiting from potential anticancer actions. Current research suggests a start low and go slow approach, allowing patients to gradually increase their dose as they assess tolerance and therapeutic effects. Ethical and legal considerations. In many regions, access to high THC cannabis products like RSO remains restricted. However, as research progresses, more medical jurisdictions are re-evaluating their stance on cannabis-based therapies, especially as evidence grows for the potential benefits of cannabinoids in cancer treatment. The ethical implications are significant. Denying patients access to potentially life-extending or symptom-relieving treatments raises questions about patient autonomy and the right to pursue alternative therapies. Conclusion. The case for integrating RSO in glioma treatment. Simpson Oil and other cannabinoid-based therapies represent a promising frontier for treating high-grade gliomas. The potential mechanisms through which cannabinoids may exert anti-cancer effects, ranging from apoptosis induction to tumor growth inhibition, are compelling, and initial case reports show encouraging outcomes in glioma patients. Furthermore, RSO offers substantial symptom management benefits, which are invaluable for patients navigating the challenges of late-stage glioma. Despite the need for further clinical trials, RSO holds promise as both a complementary and palliative treatment option. With a patient-centered approach, cannabis-based therapies could improve survival rates, and many survivors would confidently share with other patients beginning this battle that using RSO is a no-brainer. And equally important, enhances the quality of life for those facing this devastating disease.